Since 2008, girls in grades 6 and 9 have been offered human papillomavirus vaccine along with their other school-age vaccines. HPV vaccine prevents 7 out of 10 cases of cancer of the cervix. Dr. Barry Rosen of the Society of Obstetricians and Gynecologists of Canada has called the vaccine's approval a great medical milestone in the fight against cancer. Northern Health Medical Health Officer Dr. David Bowering explains what HPV is and why the vaccine is important in the fight against cancer.
Human papillomavirus, or HPV, is one of the most common sexually transmitted infections. 3 out of 4 sexually active women will get HPV at some point in their lives. Every year in British Columbia, 150 women will get cervical cancer caused by HPV. 40 women will die from the disease. 6,000 women will develop high-risk changes to the cervix, which are precancerous, and 10,000 women will need invasive procedures to stop cancer of the cervix from developing. The HPV vaccine is almost 100% effective against the 2 types of human papillomavirus that cause 70% of cervical cancer cases. The vaccine also protects against 2 additional types of the virus that cause 90% of genital wart infections.
As public health nurse Stacey Joyce explains, HPV vaccination is an important component of the school immunization program.
Since 2008, girls have had the opportunity to receive free immunization against human papillomavirus, or HPV infection, in a grade 6 and grade 9 school-based immunization program. Girls who do not receive the HPV vaccine and are now in grade 7, 8, 10, or 11 are still eligible to receive it. They or their parents need to contact their local health unit to book an appointment. In the past, I've been asked, why immunize girls in grade 6 or 9? Why not wait until girls are older? There are a few reasons why it's important for girls to be vaccinated. Firstly, girls and women are best protected when they get the HPV vaccine before they are ever exposed to the HPV virus. It's just like putting on a bike helmet before getting on your bike, not after you fall. Girls are best protected if they're vaccinated before being exposed to the virus. The vaccine prevents HPV infection, but does not get rid of it once the infection occurs. Secondly, the lining of the reproductive tract in teenage girls is still developing, and this makes it easier for them to become infected with the HPV virus if they are exposed to it. And lastly, in various vaccine studies, the level of protection from the HPV vaccine in girls aged 9 to 15 was shown to be significantly higher than the protection in adults. Younger persons have a better immune response to the vaccine. It works better. HPV vaccine is being used in 122 countries, and 68 million doses have been distributed worldwide. The accumulating evidence on the safety of the HPV vaccine is very reassuring. The most common reported reactions continue to be the same types of reactions that are seen with other vaccines: pain, redness, swelling at the injection site, and sometimes a headache. Since the start of the HPV vaccine program in BC, almost 250,000 doses of vaccine have been administered to girls in grades 6 and 9. After the school year ending June 2011, school-based clinics for the HPV vaccine will only be scheduled for grade 6 girls. Girls who were eligible in previous years but did not receive the vaccine can still be immunized and are still eligible. Parents should contact their local public health unit to arrange an appointment. If you have a daughter that has been eligible or is eligible for the HPV vaccine, I hope that you have taken the opportunity to protect her against cervical cancer. I have. If you have any questions or concerns, speak with your school nurse or family doctor.
NH Preventive Public Health recommends vaccinating on time and on schedule. For more information, contact your local health unit, your school nurse, or check out www.northernhealth.ca. Another great website for detailed information on immunizations is www.immunizebc.ca, or you can call Immunize BC toll-free at 1-877-720-2546. For Northern Health Highlights, I'm Erin Collins.